You've noticed something about the person you care for that feels off. You trust that feeling. Now, what do you actually do about it? You could be in one of three situations, and for each one, there's a clear action. But before we get into who to call, there's one thing to understand because it affects everything else. The care needs of the person you care for are not static. At different points in their journey, they may be actively receiving home health services from a home health agency, or they may not be. We call these two states in episode and out of episode. In episode means your loved one is currently receiving active home health services from your home health agency. That means nurses, therapists, and slash or home health aides are coming to your home. The clinical team is engaged. Out of episode means those home health services aren't currently active. The person you care for is not receiving any in-home care from nurses, therapists, or aides. Your loved one may be doing well, or they may be in a transition period between episodes of care. This distinction matters because it affects who you call when something feels off. And we're going to walk you through exactly what to do in both situations. Tier 1. Reach out to your care navigator. You haven't noticed any concerning changes in your loved one's behavior, but you may have some general caregiving questions. For everything that isn't an emergency and isn't a concerning clinical change, your care navigator is your go-to. Questions about accessing resources, medical equipment, or services, help navigating appointments or paperwork, emotional support, or just needing to talk something through, following up after a health event, help getting all of your loved one's doctors on the same page, anytime you're unsure, and just need a starting point. There is no such thing as bothering your care navigator. If something is on your mind, reach out. That's exactly what they're there for. Tier 2. Call the home health agency or your care navigator. This is where episode status matters most. If your loved one is currently receiving home health services and you notice a concerning change that isn't an emergency, call the home health agency's line directly. Use their main phone number when calling during business hours. If you notice a concerning change at night or on the weekend, call the agency's 24-hour nurse line. These phone numbers were given to you during onboarding. If you can't find them, call your care navigator and ask for them. Then save them on your phone and or post them on the fridge. Concerning but non-urgent changes to report to the home health agency include a fall without noticeable injury, even if they say they're fine, fever, unusual pain or swelling, not eating or drinking for more than a day, or noticeable weight loss, new confusion, unusual sleepiness, or significant behavior change, any new symptom that feels different from their normal baseline. If your loved one is not currently receiving home health agency services, your care navigator is your first call for concerning changes. They step into that coordination role when the home health agency isn't active, and they can help you figure out the right next step. This is because when your loved one isn't in an active home health episode, the home health agency isn't authorized by Medicare to provide clinical guidance. That's exactly why your care navigator steps in during those gaps. They're not bound by episode status. They're here for you, regardless. If they think the person you care for needs home health services, they can help them access services again so you both can get the support you need. Tier 3. Call 911. For true emergencies, situations where your loved one's life may be at risk, call 911 immediately. Don't call your care navigator first. Don't call the home health agency line. Call 911. Chest pain or difficulty breathing, loss of consciousness or unresponsive, signs of a stroke, face drooping, arm weakness, sudden confusion, or trouble speaking, severe fall with possible serious injury. Any situation where you feel there is immediate danger, after you've called 911 and your loved one is safe, let your care navigator know what happened. Keeping them updated will help them prepare resources or additional support for you. They can also help you prepare for your loved one's return home or next steps, so you're not overwhelmed trying to figure out what to do next. One of the things that often stops caregivers from calling is not knowing what to say. So let's walk through that right now. Before you call, take 60 seconds to write down what you noticed. 5 questions. That's all you need. What did you notice? When did it start? Is it getting better, worse, or staying the same? How different is it from their usual baseline? What else was happening at the time? Your answers to those 5 questions are your script to use when you get on the phone. Here's an example. I'm calling because I noticed a change in the person I care for. It started today, yesterday, a few days ago. This is what's different. Describe what you noticed. It seems to be getting better, worse, staying the same. Around this time, I also noticed. Describe anything else that was happening at the time that you think might be relevant. I'm not sure how serious it is, but I wanted to report it. What should I do next? That's it. You're not diagnosing, you're describing. And those 5 answers you wrote down, that's exactly what fills in the blanks. We've put these questions on a 1-page reference card you can download and post somewhere visible at home, so they're right there when you need them. What to do while you wait and after the call. Once you've made the call, here's what to do next. If you called 911, stay with your loved one and keep them calm. Follow the instructions of the 911 operator. Unlock the front door for paramedics. Don't move them unless the 911 operator instructs you to, or there is immediate danger. Have their medication list ready if you can. Keeping this on your phone can be helpful if you called your care navigator or home health agency and are waiting to hear back. Keep observing and keep noting what you see. If anything gets worse, call back or call 911. The more you can describe when the care navigator or home health agency responds, the better they can help you. If you leave a message at the home health agency's main number, you should receive a call back ASAP during business hours. If you called the agency's 24-hour nurse line, you may not get a call back until the next day. If the situation becomes an emergency before you get a call back, call 911. And here's something important. RubyWell doesn't disappear after a health event or when the person you care for is out of episode, meaning they're no longer receiving home health services. We're still right there with you. Your care navigator stays closely connected to your loved one's home health agency, so they stay informed about significant changes to the health or care needs of the person you care for. After any significant health event, your care navigator will reach out to schedule a required 15-minute check-in call with you. If you need longer, that's fine. On that call, your care navigator will make sure you understand what happened and what comes next. Check that you have everything you need: supplies, support, information. Answer any questions that came up during or after the event. Make sure you're doing okay, not just your loved one. You. We ask that you make yourself available for this call. It's a required part of the program. You should never have to process something difficult alone, and we want to make sure you're ready for anything that may happen next. And that's what this call is for. Knowing when to act is important, but knowing that someone has your back after you act, that's what makes the difference. Your care navigator is there before something happens, while it's happening, and after it is resolved. That's a promise RubyWell makes to you.